this is anchor Shivani Gupta. I'm here at India's most prestigious event, Anicon 2022 in the city of Joy, Kolkata, and here I have with me.
I'm Professor A.K. Mishra from Kolkata.
So, sir, we at IPCA, we are creating awareness about winning over epilepsy. So, sir, what do you want to say about epilepsy? How deep this topic is?
So this is a vast topic. The epilepsy, to 2%, 1 to 2% of the population, even not more, of India is suffering from epilepsy. So what we are seeing in the major city is just the tip of iceberg phenomenon. There are many cases of epilepsy, of symptomatic, genetic, because of many cases these are structural problem, non-structural problem, genetic problem. So what we are seeing is only a part of it we are seeing, but the prevalence of epilepsy is much more.
How far do you think that unawareness is one of the reason of growing epilepsy in India?
Unawareness is definitely is one of the important cause of non-identification of epilepsy, non-identification because of many taboos, many cases these are misdiagnosis by the general practitioners, and also because many cases are still seen by the coax. So all are contributing the non-identification of epilepsy cases, because if you don't have the true figure, the prevalence and the incidence as well, so you cannot take a drastic action from the government or non-government sides. So it is very important to identify by proper physician, neurologist or epileptologist, because epilepsy is a clinical diagnosis. Okay, you have to clinically identify it, then there are investigations which will be supportive. Okay.
So you're practicing from very long, if I'm not wrong. So, sir, what is the most common myth which you have come across till now? Most common myth about epilepsy?
Most common method is history. It's proper history taking and making a diagnosis and making a semiology and diagnosis. Myth. Oh, this is what I am saying is the method. So the common myth, many cases they are somebody thinks it is a social taboos, somebody thinks it is a malingering, somebody thinks it is a psychiatric problem, so somebody thinks it is a conversion reaction or hysteria. So many misconception. These are the misconception and the related diagnosis, conversion reactions, malingering. Okay, so these are coming, but these are the greatest myths.
Right, sir. One message which you want to give to all the patients who are suffering from, epilepsy. No, sir. Okay. So, sir, one message which you want to give to all the patients who are suffering from epilepsy.
So, yes, they should come forward to the epileptologist or neurologist and have a diagnosis as early as possible, because in most of the cases, if you diagnose epilepsy in time or in the early phase, you can treat it, you can cure it to a great extent.
Right, sir. It was lovely having you here at IPCA for the cause of awareness of winning over epilepsy. So thank you so much, sir. It was nice meeting you.
Thank you all for giving me the chair here.